Thank you for joining today. My name is Cheryl Fatibene. I am the Chief Nurse Practitioner Officer at the NNCC, and on behalf of the National Nurse-Led Care Consortium and the AANP, I would like to welcome you to today's Lunch and Learn webinar, What to Do Before You Start a Business. Our presenter today is Barbara Phillips, a nurse practitioner who owns and runs her own business that helps NPs get started in working on their own. Today's webinar is being recorded and will be available in the upcoming week on our Nurse Practitioner Support and Alignment Network page, and a link to the recording will be sent to all registrants. All participants will be muted throughout the presentation. I encourage you to submit questions during the presentation. Please use the Question tab on your GoToWebinar control panel as seen here to ask your question. It will be relayed to the presenter and answered at the end of the webinar. A survey will pop up at the end of the webinar as well and will be sent in an email later today. Please take a few minutes to complete this survey evaluating this activity, as your feedback is critical to the ongoing development and presentation of our webinars. The slides for today's webinar are available as a handout, which you can access via the Handouts pane on your control panel. You can click the name of the handout and it will download via your default web browser. So let me take a quick moment before we get started and talk a little bit about the national investment taking place for quality improvement in the United States with the help of our federal government and the organizations who are presenting this content as part of the Transforming Clinical Practice Initiative, which is sponsoring today's presentation. The Transforming Clinical Practice Initiative, or TCPI, is CMS's largest ever investment in practice transformation, with an investment of greater than $700 million over 4 years and an enrollment of 150,000 plus providers across the country. The NNCC, or the National Nurse-Led Care Consortium, is a membership organization with over 250 nurse-led practices on our membership roster. Our mission is to advance nurse-led care through policy, consultation, and programs to reduce health disparities and meet people's primary care and wellness needs. Our partner in this initiative, the American Association of Nurse Practitioners, is the largest full-service national professional membership organization for NPs of all specialties. It is leading the way in advocacy, continuing education, and professional development for over 72,000 members. CMS funded the NNCC and the AANP to support enrollment of nurse practitioners into practice transformation networks, or PTNs, across the country, and to develop NP-specific educational material that facilitates practice transformation in advance of the upcoming payment reform changes with CMS. The NNCC and the AANP are the only nursing-focused grantee of the TCPI project. The NNCC and the AANP agree that this initiative is important to assure all nurse practitioners receive the support they need to remain competitive in a changing healthcare landscape. Nurse practitioners are the future of primary care in the United States and already provide high quality and cost-effective care. This initiative is an opportunity for nurse practitioners to prove it by helping CMS and the broader healthcare community build the evidence-based practice while preparing for value-based reimbursement. At this time, I'm going to turn the presentation over to Barbara Phillips.
Okay, can everyone hear me?
Yes, we can hear you.
Okay, perfect. Hi, good afternoon, everyone. I'm so delighted to be here today and to talk about what you need to do before you start a business. And I just want to tell you that this whole topic came up because we often see people who maybe put the cart before the horse. And so one of the things that's really important are the things that we're going to talk about today that really set you up for success. Let me tell you a little bit about me. There we go. So I'm Barbara Phillips. I am a GMP and an FMP. I'm a fellow in the American Association of Nurse Practitioners. And I initially started a primary care practice over 10 years ago, not really knowing what I was doing. And so a lot of what I talk about are just some of the hard knocks that I took. And then I started another practice for patients with chronic pain. So I did that in Washington State. And in the meantime, when I was starting a practice, people came to me and said, well, how do I do this, when I was asking the same question of them? And so started blogging about it from the very beginning. So back in 2006, we started blogging about this whole process, and we've continued blogging that entire time. So that information is always available to you as well. And so one of the things I do now is I work with nurse practitioners around the country on starting their own businesses. What I want to talk about today is, as we said, just the beginning phases of this, but what are the 4 vital spheres to explore before starting a business? And I think that this is really important because, as I said, we kind of get ahead of ourselves. But I also want to identify some of the key factors. And then it's really important that you're ready before you start spending any money in this whole process. Okay, let's see if I can get this to move forward. There we go. So as we get started with any kind of endeavor, we've learned this from day one of nursing school, Nursing 101, and certainly as nurse practitioners, but we always start with an assessment. We always need to take a look at just where we are and what's going on, and that's basically what you need to do when you get ready to start a business. And there's a couple of different tools that I like to look at when starting a business. And the first one I want to talk about is the SWOT analysis. Now, if you take any kind of business education, if you go down and you talk to the folks at SCORE, you look at the Small Business Administration, any of that, they're going to talk about the SWOT analysis. And the SWOT analysis looks at your strengths, your weaknesses, opportunities, and threats. So that's where the SWOT comes from. And what's really great about a SWOT analysis is you can take this framework and you can look at a large picture, or you can tailor it down to just a small aspect of that. And you can even use this in your own life. So what are the strengths of something? What are the weaknesses? Where maybe do you need to get a little bit more information? What are the opportunities that are available to you? And I think for all of us, if we stop and think about it and start looking at things a little bit differently, we will see opportunities absolutely everywhere. And then just what are the threats, like third-party payers not paying, that sort of thing. The other thing that I like to do is I like to take the SWOT analysis and also use it in another framework. And this is a framework I actually came up with, and I call it the PPFM analysis. And it stands for the Personal, Professional, Financial, and Market. And the whole point about this and looking at these domains is it should help you answer that question, should I start a business? And it doesn't matter if we're talking about a practice and what kind of a practice. It doesn't matter if we're talking about maybe a non-clinical business, because nurse practitioners do those as well. But it should take a look at all of these different things, and you can put the SWOT within many of these areas and come up with some answers. So I want to go through each of these and talk about the important parts of each of these. Now, obviously, we can't talk about the entire thing because I could be talking for 3 or 4 hours on this topic, but let's just go over the highlights of it. So when we start with the personal analysis, it really does start with you. And when we look at that, there's questions that we need to ask. Sorry about that. I'm having a little trouble moving this forward. So one of the things that's really important is, what do you want in life? Starting a business is a big endeavor. It's going to take a lot of time, energy, money, your own resources, and so it's really important for you to really understand what you want. And I'm always surprised at how many of us don't really understand what it is we want. And that's when I really encourage people just to keep asking, what don't you want, what don't you want, what don't you want, until you really get down to your own core values of what it is that you want. It's important as well to look at your goals. Starting a business, any kind of business, as I said, takes a lot of time. But, you know, if your lifestyle demands that you are going to be spending a lot of time with your children, that you want to do a lot of travel, that you have certain income, you know, you need to be really clear on what that is, and is this going to fit in with the type of business that you're creating? So for instance, somebody who wants to do a lot of travel and maybe travel, you know, 8 to 10 weeks out of the year or more, that's fine. But then what are you going to do if you have a brick and mortar practice, a primary care practice? If you're not there, are you going to get other people to be there? So you want to think about these kinds of things. The support issue is so important because of the time that it's going to take you to do this. And if you stop and think about it, if you think about an airplane, when they first take off, that's where they burn most of their fuel, and then they coast, right, when they get up to cruising altitude. When you start a business, you're going to be spending a lot of time and energy in the beginning. If you have a family, your partner, your spouse, your children who are not supportive, want you to be fully with them, then it's going to take away from the business. And so you need to consider that. There have been nurse practitioners, nurses, and others who have started businesses, and it's really put a strain on their relationships. So you want to think about that. And what about the support with your friends, your community, your colleagues? That's pretty important as well. And I'll tell you, when I wanted to start a practice well before I did, I kept hearing from everybody around me how difficult this was and not to do it. And I really wish I had found people that could support me and help me through that, because I would have started my practices much, much earlier than I did. So really take a look at what kind of support you have, and if you don't have it, where can you get it? And we're going to talk a little bit later about the professional support that you need. But right now we're talking about your family, your friends, just in your community in general, and certainly your colleagues. Do you have the time to do this? Again, it takes a lot of time, takes a lot of energy. You know, are you currently pregnant with triplets and trying to complete your DNP? Well, then you don't have the time to start a business, and you need to put it on the back burner. And I'll tell you a little bit of a story. I worked with a nurse practitioner last year when she started her practice, and she's done quite well. She has a specialty practice, and I didn't know it until she was graduating that she was going through her DNP program at the time. She now says that she never wants to relive that year again because it was so difficult, and she wouldn't recommend that anybody else do the same thing. So you do want to consider that. And then what does your exit look like? So what are you going to do with this entity that you're creating? What are you going to do with it when you're done with it? And what done means is up to you. It could be you're retiring, you're tired with it, you want to sell it and move on and do something different. But you need to figure out how you want to exit the business. Okay, so again, it may be you're bringing in a partner and you'll turn the business over to the partner. Maybe you're going to sell it to a larger practice. Maybe you're going to have a child who is going to grow up and become a nurse practitioner and want to inherit the practice. However you want to do it, it's a good idea to be thinking about that when you get started, because it does matter when you start setting it up. Biggest question of all, why is it that you want to start this practice? you became a nurse. You became a nurse practitioner for a reason. And there's been times in your career, whether it's been short or long, that you probably you hold your head in your hands thinking, why on earth did I go this route? And for the most part, it has given you the energy to keep going because there is a purpose behind what we're doing. For most of us, it's because we want to make a difference. So I'm getting a lot of feedback. Sorry about that, everyone. Okay, good. So you want to think about what is it that is going on for you? Why is it that you want to do it? What is your purpose behind this? Because when the time gets a little tough, it'll help you keep going there. So let's take a moment and talk about professional analysis. And this is pretty straightforward, I believe. And it's really taking a look at where you are. And as you know, our rules and regulations are different from state to state. So what are they in your state? What are they in your location? Take a good look at your scope of practice. Take a good look at what is in your rules that may be a barrier for you. What's going to prevent you from going out and being independent? And when I say independent, I just mean practicing on your own without somebody else there. Independence has a lot of different meaning, and I in particular feel that we all collaborate, and so I'm not sure independent practice is quite the way to go, but I think we all know what we're talking about. But it's just, what are the rules that might prevent you from doing what you want to do? So for instance, you have some states that will say you cannot own your business with somebody else unless they have the same license that you have. And in some states, you cannot own a medical business, but you can own a nursing business. So you want to be aware of all of those things. You can get a lot of that information from the Secretary of State in most states. It'll be the Secretary of State. I would highly recommend you not only look at scope of practice, whoever oversees nurse practitioners in your area, that you look at the medical board's scope, particularly in regards to collaboration or any rules, and also the Secretary of State. Now, there is one state where I actually haven't seen it in writing, but I've talked to the organizations in that state that says a nurse practitioner cannot own a corporation, period, cannot own their own practice, and that is Michigan. So I would, if you are in Michigan, if you have a practice in Michigan, and I know that there are practices in Michigan, I highly recommend that you talk with your organization there to get the up-to-date details about that. But that's a question that comes up. So anyway, just make sure that you are fully aware of what it says for your state. Let's talk about collaboration, because this is probably, next to how to start a practice, this is probably one of the biggest things that I get a question about. Again, go back to your state rules. Know exactly what it says about collaboration, because when you create your written agreements, and they need to be written, if you do not have a written agreement, go back and get one for collaboration. But you want to make sure that you're following your current state rules for collaboration, and you get it in writing. One of the things that you want to have in writing is what kind of notice do you need from your collaborating physician, because you do not want to get to your practice one day, on a Wednesday for instance, and get a phone call from your collaborating saying, I'm done, I'm out of here. Then you're kind of dead in the water until you can get another collaborator. So you need to have something in there that talks about notice. And I would not do 30 days at all. I would do at least 60 or 90 or even 120 days notice before you stop that collaborative agreement. I get a lot of questions about costs. And one of the things that I would tell you is look to see what's happening in your community. because the cost of collaboration, for instance, in California may not be the same as in South Carolina. So you need to know what is happening in your community. And of course, should collaborators be paid? My take on this is if they're having to do work like visit your practice, sign up charts, et cetera, et cetera, et cetera, I do think that they should be compensated for their time. If they're not doing anything but giving you a name on a piece of paper, well, that's where I have a little bit of problem. But you're going to have to look at what's usual for your area. Make sure in your agreements that you include a clause for when you get full practice, because all of us eventually, even here in Missouri, we will have full practice authority at some time. But if you're having to pay a collaborator, you don't want to keep paying them just because you didn't put a clause in there that says you no longer need a collaborator, so you don't have to pay anymore. Always have a collaborator or two in your back pocket. Many nurse practitioners have had to stop practicing because they had no collaborator. So if you have one on the back burner, maybe they're just an on-call type person, or maybe you have two going at one time, it's insurance for your business. Oops, sorry about that. Go back one. This is a biggie. Are you really ready to practice? Are you a new graduate? Have you only been out of school 6 months? Not recommended. At least I don't recommend. Now, there's always exceptions to the rules, but for the most part, if you're a new graduate, you really need to get your NP legs under you. Excuse me 1 second. I'm just going to get some water. Sorry about that. Okay, so make sure that you're clinically ready and make sure that you have any licenses or permits that you might need for your area. It's really important that you have a professional support team. So one of the first people that you need to see, I think, is a CPA, because they can advise you based on your tax status on what kind of a corporate structure, plus they know the rules and regulations for your state. It's helpful to have one who has some health care experience as well. Do you need an attorney? A lot of people say yes, you absolutely do. A lot of people say no, I didn't do this with an attorney. I just did it with my CPA and got started. That's fine, but you need to have access to an attorney. And you definitely want one on your team. You want to be able to pick up the phone and call somebody when you need it. So definitely, I would say have an attorney. I think a business coach, barring the fact that I am one, I think a business coach is a good idea. You went to school for years to be a nurse, for years to be a nurse practitioner. You didn't learn business for the most part. Now it's a little bit in school, but you still don't know the nuances of doing a business. And so I think getting that education is really important to set yourself up for success. And of course, there's a lot of other professional support team members that you may or may not want to have in your practice, depending on what is going on. So let's talk about financial, because this is probably one of the biggest areas, and I apologize for my voice here. When we talk about finances, this is the question that is so important for you to answer. Is this whole endeavor going to be financially feasible? Are you going to make a profit, or are you sinking yourself into an abyss of debt? And you need to be very careful with this. And this is where business plans come in. But before you can even get to the business plan, you've got to answer some questions and do some research. And then I highly recommend that you put it down on paper or get out the Excel spreadsheet and start plugging in some numbers. So where is your income going to come from? What kind of a model are you looking at? And when I talk about a revenue model, particularly nurse practitioners doing cash-only practices, we see other nurse practitioners doing your traditional third-party payer practices. And then I also see a lot of people who are looking at nonprofit practices, maybe practices where people don't pay anything. And let me just, here's my little thing on free practices. First of all, there's no such thing as free, and I think we all need to get that out of our vocabulary, but there is sponsored care. So I think that that is something that you can use. But even if you were doing a nonprofit practice, you have to generate revenue somewhere in order to make it work. So that's why I think we should get rid of the free. But again, whether you do cash only, you do third-party payers and cash, however you do it, you've got to determine what that is. You need to look at what your fees are going to be and your reimbursements. And it's really hard, at least it was for me, and I think it is for a lot of people based on the questions, but what is my reimbursement going to be? Well, the only public fee schedules that are out there are going to be government ones, and that is going to be Medicare, Medicaid, and workers' comp. Your Blue Cross, your Aetna, United Healthcare, all of them, they view the fee schedules as proprietary. So many of us start off by just looking at these other fee schedules. And I caution you, when you look at the fee schedule for Medicare, Medicaid, and workers' comp, they are almost always based on the physician allowable. And so that's another thing you need to know. Is there going to be a difference in your area? So for Medicare, for all nurse practitioners, currently we are reimbursed at 85% of the physician allowable. In the states, it varies. So in Washington State, I had 100% of the physician allowable for Medicaid, but in other states, I know it can be 60%. So you really need to look and see what it is for your state. Are you thinking about other sources of revenue in there? So you want to think about that. A lot of people will add things like Botox and other cosmetic procedures to other practices. And you want to have as many streams of income as possible. The other thing, too, is you want to have as many streams of third-party payers as possible. It's really important for you to look at that payer mix. Do not put your eggs in one basket, ever, when you are looking at a practice. So we also need to look at expenses. And when we talk about expenses, we're talking both your startup expenses and your ongoing. So startup are going to be things that you have to invest in for the first time in order to get your practice going. Maybe you're purchasing a building, or maybe you're just leasing it. So whatever startup costs there to get that going. If you have to do a build out, so if you get a space and maybe it's an empty shell and you have to build in the rooms and everything else, that may be there. Any renovations that you want to do. Now sometimes with build outs and renovations, the owner of the property will do that for you, especially if you have a longer lease. But if it's a shorter lease, then they're going to want you to pay for that. Supplies and equipment that you need to get started, professional fees, training, all sorts of different things would be that one-time startup cost. Your ongoing is everything else that you're going to pay on a monthly, quarterly, or annual basis. Now, the biggest line item for any practice, for any business, is going to be staffing. And it's not just that $10, $15 an hour that you're paying somebody, but it's all the taxes and all the human resource costs that go into that. So salaries are quite high for people usually. That's usually your highest. But you look at your rent or your mortgage, professional fees, cost of collaboration, all of your supplies. The cost of billing insurance companies is not an inexpensive proposition. Okay, and it's more than just whatever you're paying your biller. There's a lot more that goes into that, so you need to be aware of that. Marketing, we have a lot of great resources to market these days, but it does take some money. And insurances and a whole lot more. And again, this is going to be tailored to whatever kind of a practice that you have. Now, if you're going to do a mobile practice, you're going to have a lot less of these fees because it's a lot less expensive to do a house call practice or any other kind of mobile practice where you're seeing patients on site. So you keep that in mind as well. This is what you're aiming for. To begin with, you really want to balance things out. That's great, but in 3, 6, 12 months, you want to see your income going up and your costs staying pretty stable. Now, your cost will go up periodically as you expand your business, and that's a good thing, but you still want to see this upward projection and not just staying balanced and not moving. What you don't want to see is that your costs outweigh your revenue that comes into your practice, and I think that's pretty straightforward for most of us. Where do you find the money? Find the money wherever you can find the money, but there's some caveats and things that you want to be cautious about. A lot of people will have personal savings that they will use. Other people will use personal loans. Now, personal loans can get a little bit sticky when you're borrowing money from family and friends, so one of the things that you really want to consider is making it a legal proposition. And there are many banks that will set it up for you so that it becomes a legal thing. The money goes into a bank account when you make your payments and all of that. And it makes the person who is, that you're borrowing from feel a lot more secure. Home equity loans can be done. I caution on that only because I know of a couple of people who have ended up losing their homes because of what happened with their businesses. Commercial loans are always a good way to go. A lot of people will tell me, well, what about a small business administration loan? What that does is just guarantees, it gives a guarantee so that when you go to the bank, whether it be a local bank or a larger bank, they are going to be more comfortable in giving you a loan because you have a guarantee from the Small Business Administration. If you don't need to get a loan, please don't, because it just adds to the debt that you have to pay back. What about credit cards? A lot of people actually do use credit cards. If you use them responsibly, you can certainly do that. If you have a credit card that has a low interest rate and it's lower than you can get a loan and you don't need that big of a loan, then you can do that and just pay it back as quickly as possible. So it really depends on your situation. I also get a lot of questions. What about a grant? Can I get started on a grant? In many cases, the larger grants that are available, you need to be a nonprofit, but your community may have some business grants to encourage business development in the community. So you can certainly look at that. I don't have really a lot of time to go into social lending and microfinancing, and I encourage you to Google that and find out what that is. But basically, it's private parties saying, I have so much money, I'm not getting good interest at my bank, and I want to put it out there. And it's done in a legal way. People make a loan application. The person looks at it and says, great, I want to finance this. This is the interest rate. You both agree, and everybody is happy. So that's certainly an option. And I've heard people talk about some of the, like the Kickstarter, GoFundMe type of situations. And I've seen practices actually put it out there to try and gather startup funds for those kinds of practices. I haven't seen one be successful yet, but who knows. And if you get investors, remember that investors will then own part of your business. They will be stockholders in your business, and you'll be paying them dividends and the like. What about market analysis? So remember back to nursing school. Excuse me, no, that's not me. Okay, remember back to nursing school when you did a community assessment? Well, this is what we're talking about here. We want to figure out who you're going to be offering services to and who else is doing this in your community. So who is it you're going to serve? You know, who are the clients? Now, when I was doing a course one day, and somebody told me that she takes care of everybody from the womb to the tomb. That's great, but you need to have a population that you really want to focus on, because you can't focus on everybody. You need to have everybody else will come along that is going to hear all of your messages and stuff, but you still need to know who is it primarily that you're going to serve? What do they want? What do they need? Is anybody else providing it? What kind of demographics? Are you doing insurance or not? You know, what is going on with that population? And are they willing to pay for your services, particularly if you're looking at a cash practice? You also want to know who else is playing in your sandbox, okay? So what's out there? Who else is providing the same services that you want to provide? And that's when you really start digging down and looking for any opportunities and challenges to what's going on. I often hear from nurse practitioners, well, there's nobody else in the area. Well, then you don't have anybody else playing in your sandbox, but you're still going to have some challenges there. And you're still going to need to figure out how you're going to do this. What holes can you fill for the other people? And this is really, I think, the key. What can you do differently and better than the other people that are providing services? Now, I hear from people all the time, well, we already have 5 family practices. We already have somebody doing house calls. There's already somebody doing this and that and the other. One of the things that you will hear in business education seminars all the time is competition is good. Somebody else has already gone out and done the market research. They have determined that there's the need. They've been in business for a while. So clearly, you know, it's out there. As long as it's not oversaturated, you do want to take a look at that. But if you look at around any hospital in any city in the United States, any town in the United States, there's always a whole bunch of healthcare offices. There might be 6 pediatricians, 14 family practices, 10 internal medicine practices, a bunch of rheumatologists, some surgeons, et cetera, et cetera. There's a need for that. You know, so it's not that just because you have all of these people doesn't mean you cannot do the practices. My very first primary care practice, we had tons of family practice clinics, internal medicine and specialists and everything else in a little town of 17,000 people. We happened to be the hub for the county, and this was kind of rural, so that our county only had 60,000 people where I was. And yet, there was such a shortage. The hospital had determined that we were down by 10 primary care offices and that our community clinic that was in town was getting ready to close. And so there was a huge need. So don't look around and assume that just because there's a bunch of offices that there's no room for you. There certainly was. And I will tell you, that primary care practice, when I opened, I had a full panel of patients within a couple of weeks. So, and that was because the need was there. So again, just because there's all these other people around doesn't mean that it's not a good fit for you. As I said, it's really important to differentiate yourself. So some of the questions that you want to be asking is, what is it that people don't like? You know, does this provider over here, do they have a good reputation? What are people saying about them? Oh, they don't listen. They don't really care about me. I can't get in unless there's no opens for Saturday morning, and that's when I really need to be seen. Or I work these hours and I really need an after hours. So look at all of those things and how you can differentiate yourself. For those of you that are doing house calls, do you only do scheduled house calls, or are you doing house calls on an as-needed basis? Do you go into certain communities? Do you add, are there things that you can do value add for those practices, for those clients that you see, so that you stand out from the rest? You don't want to look like everybody else is rubber ducky. So hopefully that's pretty clear. And when you start looking at all of it and you put it down on paper, does it make sense for you to continue moving forward? Can you make it work? Do you still even want to do this? I've had people who've taken a look at it and started working on this, and then they go, oh, no, I really don't want to work this hard. I don't want to do this. So If you get to this point, you still want to do it, can you make your numbers work? And how well can you make your numbers work? One of the things that I did, because I didn't know any better when I first started, I just looked at and I said, okay, here's the Medicaid rate. That's what I knew. Here's what they're going to reimburse for 99213. How many patients do I need to see per month in order to make my overhead? And that was how I figured out whether I can make my numbers work. It was a quick and dirty way. Anything over that, of course, was gravy for me. It really, and that's what exactly happened for us, because I don't know about you, but when I've done primary care, I hardly ever see somebody who's just a simple sinus infection or a UTI or a cold or simple blood pressure. We don't see those kinds of patients, even though everybody thinks that we see simple patients. So chances are you're going to have higher coded visits. Do you have the support that you need in order to move forward? And do you have the drive, the energy, and the determination? Because if you do, you can absolutely do this. You can make it work. And that's what is so important. And I am so heartened to see so many nurse practitioners now going into business, because this is, you know, for those of us that want to do it, this is perfect. If we don't want to do it, that's great as well. So I want to thank you. This is my contact information. I just want to say that I know we'll get a lot of questions, and a lot of this is answered in different places, but this is how you can get a hold of me. And I think we're going to questions now.
Thank you so much, Barbara. That was so informative. I really appreciate you taking the time to be with us today and share your wealth of information. Just a couple things came up as we were going through questions. People were wondering about the slides, and it is available as a handout. If you look on your web pane there, you should see handouts, and you can highlight that and you can download it that way. I know we had some questions early on about you know, being able to hear the presenter. I hope at this point we were able to work many of those out. So we are getting questions that are coming in right now. So this is the time we're going to spend the remainder of our time together with questions. So if you do have a question for our presenter, please type it into the question tab on your GoToWebinar control panel or raise your hand. And I'll give everybody a minute or two, and we're going to go ahead and do that. And I just see a question here that came up from Jade asking about this being available as a recorded presentation, and it will be. You will get the link afterwards, after having signed up for this, so you can go to Vimeo and you can listen back through it again. I know there was so much information, and it's just great the way that Barbara presents it. It seems so simple, but it'd be good to go back and review it all again.
Okay, so we've got a number of questions coming in, Barbara, and the first question comes from Erica. Erica is asking, would you recommend continuing a full-time or at least part-time employment until your practice is started and profitable?
That's a great question, Erica. Actually, several nurse practitioners will do that. Not many people will just take the jump and jump in, because you do need to have cash in order to keep that operational. So a lot of people will do part-time. And again, it depends on what kind of a practice that you are trying to start and where you're trying to start it. But yeah, if you can work that, it's a good idea to do part-time and then go in. My very first time at this, I just jumped in because of the situation that I was in. I would have preferred to do it part-time, but it ended up working okay for me. So yeah.
Great, thank you. The next question comes from Kathy. Kathy is asking, can you take insurance and self-pay? And if so, does this vary by state to state?
So that's actually a very good question, Kathy. Yes, you can take both. But here's the thing about it. When you have a contract with an insurance company, they will often tell you that you are required to bill that insurance company. And certainly if you're a Medicare provider, well, actually it doesn't matter. Because you're a nurse practitioner, you're an eligible provider for Medicare. So you can't just take cash from your Medicare patients. You would have to opt out of Medicare and enter into a contract with your Medicare patients. And that's a whole other topic. But you can do both. So if you have somebody who has no insurance, you're fine. You can take cash. If you have somebody who has Blue Cross, you take Blue Cross, and they don't want to pay you, they don't want you to bill the insurance company, they want to do it cash, chances are you can't. So those are the rules. It doesn't matter what state you are in, but you do need to be aware of what your contract says, and yeah, you can do both. I always had both because I had patients who just didn't have insurance, so I took both.
Alrighty. The next question comes from Kurt. Kurt is asking, how do you determine a fair collaborative agreement fee?
Hi, Kurt. Well, one of the things that you want to do, like I said, is you take a look at what is going on in your community. Now, it may be that your community has nothing that is fair, but you want to start there so that you're not paying, say, San Francisco fees when you should be paying, you know, Mexico, Missouri fees. But one of the things to do, too, that we didn't really touch upon, when you are looking at a collaboration agreement, you want to find somebody perhaps that knows you, that's kind of in your inner circle. You're less likely to pay a huge amount of money that way. You get somebody who wants to help you out, and then you kind of expand outward. But, you know, look at, one of the things I would say too is I really frown upon percentages of your patients. So if you're seeing a certain percentage of patients or a certain reimbursement of patients, because that number can get out of hand very, very quickly as you grow your practice. So I prefer flat rates. It would be nice if they would stagger the rates so that you start off, if you have hardly any patients, and then it goes up from there, but also take a look at what it is that that physician is required to do for you.
All right, thanks, Barbara. The next question is coming from, let's see, Tina. Tina is asking that there seem to be a lot of NPs starting companies that perform health risk assessments. What are your thoughts on this? Do you know about these? Are these a good idea?
As far as what is a good idea for a practice, it really depends on what it is that you want to do. If starting a practice that just goes after risk assessments, you know, is that something that is going to keep your interest going for the next 10 years or something? So I would really take a step back and think about it from that perspective. NPs are starting all kinds of practices and all kinds of businesses. And again, it comes down to how are you going to be able to make it work? So regardless if it's a derm practice, if it is these health assessment practices, and a lot of people are in that because it's paying, and even the insurance companies, they're doing their own spin-off companies to do this. So that's, you know, how long is it going to last? I don't know. One of the things that does concern me, especially if all they're going after is Medicare, that is putting all of your eggs in one basket. So I would really caution you on that. But the bigger question is take a look at where your passion and your skills are when you're getting ready to start a practice.
Okay, next we have a question from Jessica. Jessica says, I've been working on starting a business for a few years, but I'm in the military. I'm concerned about starting the business and meeting those requirements. Do you have any suggestions about finding a partner or covering an individual while I'm gone?
So, yeah, okay, partnerships. If you want to get into a partnership, you need to be cautious there and make sure that you definitely work with an attorney when you're sitting at partnerships, because when you go into a partnership, in many cases, whatever that partner does, it also the liability is also completely yours. So you do want to be careful there. Finding people to take over your practice while you are away, if you get deployed or you're having to go and do some time or something, you need to consider the costs of that as well. You may just want to wait until you're done with the military, or figure out how you can do a practice on a part-time basis. It kind of depends on what you're doing.
There is a question coming in about, it's from Claudia. It says, do you have someone I could speak with regarding a house call Petrograd? I'm not sure what that is. I am interested in initiating one. Maybe you can tell us what a Petrograd is.
I don't know what a Petrograd is.
Okay. Hang on here. We're going to move along. Okay. Can you estimate the capital that you should have on hand to begin the early exploration phase of opening up your own practice? Approximately.
Okay, so the amount to explore really shouldn't take you a whole lot of money to explore. It's just you're doing your own time and your own research. When you get ready to start the business, you're actually starting. I have heard that some people will say you should have a year's capital in order to keep going until reimbursements and everything evens out. Others have said 6 months, others have said 3 months, and I know plenty of people who bootstrap the whole thing. So a lot of it depends, again, on what you're doing and what your projections are actually showing you. But, to be on the safe side, 3 to 6 months is always a good idea.
Thanks. So getting back to the question from Claudia, I think what she was asking was how to start or integrate in house calls into your business. So if you could address just the house call issue in general in a practice.
Okay. So, all right. So that's great. So in my primary care practice, I actually did see people at home. I saw my own patients at home, and I also saw them when they went to assisted living facilities. So I would just carve out days to visit. The key thing here, and we actually ran into a little bit of a problem with this, is our biller, because we had seen these people in the office, they were coding for place of service for still the office when it was at home. So we were having a lot of problems with billing regarding that. But if you want to see your patients at home as well as see them in the practice, you can. You do need to be aware of what the rules and regulations for that insurance is to pay you to see somebody at home. Do they require that that person be completely housebound or not? And those kinds of things will make a difference. But it's not hard to vary how you see your patients. You just set up your schedule that way. So I hope I'm understanding this question correctly.
Okay, great, thanks. A question from Erica asking about, I guess, sort of the legal ramifications or the protocols. Sounds like she's saying if you work in a hospital setting and you start a practice that may benefit the hospital, is there a conflict of interest agreement, or is there some sort of agreement you would need to enter into so that it would not be seen as a conflict of interest?
Okay, so I guess I'm trying to picture how that would be. When we see patients on an inpatient basis and then we're seeing them on an outpatient basis, just like any physician who might see people in-house and then also have a practice, that patient will go to that particular hospital, and I think this is what you're asking, is that seen as a conflict of interest? And generally not, especially if there's only one hospital in the community. When you start thinking about, because this sounds kind of like, is this a kickback kind of situation or start clock kind of situation, one of the biggest things is find out, give your patients a choice. They can choose to go to the hospital that you work at. They can choose to go to a different hospital. They can choose to see this physical therapist or that physical therapist or that physical therapist. I think if you keep it open-ended, you're okay. Now, some of the issue, though, may come in when we are either working for somebody else or we're working clause. You want to make sure you're doing that. And then the other thing will be if you are soliciting for patients in that environment, then you're definitely going to have a conflict.
Okay, and you were correct. The questions keep rolling in. We'll get through as many as we can in the next 5 minutes. So Jessica says that she knows of a clinic that's using student NPs, student RNs to staff. Is there any legal ramifications on using this strategy versus hiring regular staff?
I don't know of any legal ramifications. The one issue that I would have, I mean, this is on-the-job training, if you will, for these people, but you can't, those student NPs and student nurses cannot, their work cannot be used for billing purposes. You can't bill those out. So if that student NP is seeing a patient or that RN is doing a nurse visit, you cannot bill for those.
Okay, a question from Sarah. You had mentioned the market analysis before, and she's asking how to get the information for market analysis, or must you perform it yourself? Are there any resources out there that you can recommend to do this?
There may be services and companies that will do this, particularly in larger locations, but basically you can go to the health department, you can go to your Chamber of Commerce. They have all kinds of statistics for your particular area in terms of the financials, insurance, health needs, the demographics of the people that are there. So that's where I would start.
Okay, there's a question from Daipan. It says, can I get self-pay from a patient and charge insurance for an assisted living facility? Or is it only one way or the other?
If you have a contract with that insurance company, it is one way or the other. So now when you do insurance, just be aware that your patients will owe you a copay, coinsurance, and deductibles. I mean, those things have to be taken care of. So that would be the only money that you can collect from most of your patients.
Great, thank you. Next question is from Rainford. Are there typically any issues with obtaining liability insurance coverage for NPs who go into a specialty practice business, such as aesthetics or infectious disease?
You would need to talk with the insurance companies, but there hasn't been that I have heard of. Now, for aesthetics, there may be special insurances for those folks, just like for midwives. You know, if you call up, you know, Mercer or somebody like that, they'll say, are you a midwife? We don't cover you. So, and I don't know if that's true for Mercer. I'm just using that as an example. But you would just need to talk to the insurance companies.
We have a question from Edwina. What are your views on starting a telemedicine practice?
Go for it. I mean, that's, nurse practitioners can start any kind of practice that they are clinically competent to start. Just look at your rules and regulations. You know, be aware of what the rules are around telemedicine. You know, you need to be licensed in the particular states that you're seeing your clients and stuff, but yeah, go for it.
So there's a question here from Kim, who's 2 years as an NP, and talked about being clinically ready before starting your own practice. And she's asking for how many years should you be employed as an NP before I start my own practice? And I just wanted to mention personally, you know, 5 years was the mark for me in terms of feeling extremely confident from a clinical standpoint, but obviously it's going to vary from person to person. So I wondered what your thoughts were on that, Barbara, and this is going to be our last question.
Well, I actually, the same thing. It depends on the individual. It really does depend on the individual. So I don't know what your experience is prior to becoming an NP. I don't know how you currently practice. You know, do you feel comfortable? Do you always have to go to somebody to maybe get some backup? You know, you're the one who's going to know whether you are ready. And I would look at it that way. And that's something we can certainly have a talk about, because there's a lot of questions I would ask. You know, again, how often do you have to utilize the collaborator? How often are you having to look up things? How are you doing with your whole process of seeing patients and the documentation? And just, you know, are you having any problems with that? Or are you running on your own and you never have to grab somebody and say, come look at this, I don't know what to do. So it's individual, very individual.
Thank you for that. And we have a final couple slides here, just wanted to get through since we have reached the end of our hour and it has flown by. So if anyone on the line has an interest in learning more about the Transforming Clinical Practice Initiative, which will get you ready for payment reform, or you have any additional questions, our contact information is there. I would also highly recommend the link at the bottom to look at the AANP overview of what we're doing with the Nurse Practitioner Support and Alignment Network to see if this is something you'd like to be part of. Also, too, each month we do run these lunch and learns. So they are recorded, and as we said, you'll be getting something when we're done. The lunch and learn coming up for next month is going to be talking about cultural and linguistic competency. And if you have any additional questions, again, feel free to reach out to us and you can ask those offline. We're also going to be sending Barbara all of your questions. So if she did not answer your question today, she will get a list of questions and she'll be getting back to people. She does run a blog. A lot of the questions that you may have asked may be answerable in the blog. So we'll be following up with her. And I just wanted to thank Barbara again for your time, your expertise, and we'll be closing out the webinar for today. Thank you, everybody.
Thank you.